Welcome to a new video, and thanks for being here today. Have you ever felt that your body is trying to tell you something but you can't quite understand the message? After age 60, our bodies begin to change, and we often mistake important signals for simple age-related aches and pains. Diabetes is one of those silent conditions that can develop slowly, sending warnings that many of us ignore until it's too late. Every year, millions of older adults are diagnosed with type 2 diabetes, but the reality is that many of them had already been showing signs months or even years before. Signs that, had they been recognized in time, could have allowed for early interventions and lifestyle changes that would have made an enormous difference. In this video, we're going to reveal 7 warning signs of diabetes that appear after age 60 and that most people overlook. Some may seem harmless, others can be easily confused with normal aging, but all deserve your attention, because recognizing these signs in time could be the difference between living your golden years with health and vitality or facing serious complications that change your life forever. This video provides educational information, but only your doctor can offer you a diagnosis and treatment plan appropriate for your particular situation. Stay with me until the end, because the last sign is one rarely associated with diabetes, but studies show it can appear up to 2 years before diagnosis. Now, let's begin with our list. Sign 1. Unexplained fatigue that doesn't improve with rest. The first sign that many older adults overlook is a profound fatigue that doesn't go away even after a good night's sleep. We're not talking about normal tiredness after an active day, but a persistent exhaustion that makes even the simplest tasks feel overwhelming. Why does this happen? When blood sugar levels are elevated, the body can efficiently use glucose to produce energy. It's like having a full tank of gas, but an engine that can't use it. The result is a constant feeling of exhaustion. Mary, 67, noticed she suddenly needed to take afternoon naps, something she had never done before. At first, she thought she was simply aging, but when the fatigue began to interfere with her daily activities, she finally consulted her doctor. Tests revealed elevated blood sugar levels. What she had considered a simple symptom of age was actually an early sign of type 2 diabetes. If you've noticed that you feel constantly exhausted, especially after eating, or if you wake up tired even after sleeping well, don't ignore it. This could be your first warning sign. Sign 2. Increased thirst and frequent urination. One of the most classic but frequently ignored signs of diabetes is a sudden increase in thirst and the need to urinate, especially at night. Many older adults assume that urinating more frequently is simply part of aging, or attribute it to blood pressure medications. Others think that constant thirst is due to the weather or not drinking enough water. What's really happening is that when blood sugar is elevated, the kidneys work overtime to filter and absorb the excess glucose. When the kidneys can't keep up, this excess sugar is eliminated through urine, dragging fluids from tissues along with it. This makes you urinate more and, as a result, feel thirstier. For Charles, 72, getting up 2 or 3 times each night to go to the bathroom had become his new normal. It wasn't until his wife commented on the amount of water he was constantly drinking that he decided to mention it to his doctor. The A1C test revealed he already had prediabetes. If you find yourself drinking much more than usual or making frequent trips to the bathroom, especially during the night, pay attention. Your body could be sending you an important message. Sign 3. Wounds that are slow to heal. As we age, our healing process naturally slows down. However, there's a big difference between slower healing and wounds that seem not to heal at all. This is a warning sign that many older adults incorrectly attribute solely to age. In diabetes, elevated blood sugar levels can damage blood vessels and reduce blood flow, especially to the extremities. With less blood reaching a wound, there are fewer nutrients and immune cells available to repair it. As a result, even small cuts or scratches can take weeks to heal. Helen, 65, had a small cut on her foot that she noticed after a day of gardening. 3 weeks later, the wound barely showed signs of improvement. Her doctor not only treated the wound, but also ordered blood tests, revealing elevated glucose levels. The early diagnosis allowed Helen to take action before developing more serious complications. If you've noticed that your cuts, scratches, or bruises take much longer to disappear than before, don't attribute it just to age. It could be a sign that your body is struggling with elevated glucose. If you're finding this video helpful so far, please type health in the comments and make sure to subscribe and turn on notifications to receive more informative content like this. Your support helps us continue creating educational videos that can make a real difference in your life. Sign 4. Vision changes or intermittent blurry vision. Vision problems are common as we age, and many older adults simply assume they need to update their lens prescription when they notice changes. However, sudden blurry vision or vision changes that come and go can be early signs of diabetes. When blood sugar levels fluctuate, they can affect the fluid in the lens of your eyes, causing swelling and temporary changes in vision. Some people experience blurry vision, while others notice difficulty focusing or even see floating spots. Robert, 68, noticed that sometimes his vision would become blurry while reading the newspaper, but then improve after a while. He assumed his eyes were tired, but during his annual eye exam, his ophthalmologist detected changes that suggested possible blood sugar problems. Subsequent tests confirmed prediabetes. If you experience vision changes that come and go, especially after meals, don't wait for your next appointment with the eye doctor. This fluctuation could be related to your blood sugar and deserves medical attention. Sign 5. Tingling, numbness, or pain in hands and feet. Many older adults attribute these sensations to arthritis, poor circulation, or simply age pains, without realizing it could be early diabetic neuropathy. Neuropathy occurs when elevated blood sugar levels damage the small blood vessels that feed the nerves. This damage can begin years before a formal diabetes diagnosis, starting as mild tingling or numbness sensations that progressively worsen. Sophia, 74, began to feel a constant tingling in her feet, like static or pins and needles. For months, she ignored it, thinking it was due to standing too much. When she finally mentioned it to her doctor, blood tests revealed her sugar had been elevated for some time, causing early nerve damage. Don't ignore unusual sensations in your extremities, especially if they tend to worsen at night or affect both sides of your body similarly. They could be the first signs of nerve damage related to diabetes. Sign 6. Recurrent infections or infections that take time to resolve. As we age, our immune system naturally weakens, making us more susceptible to infections. However, if you notice that you're suddenly experiencing more frequent infections or ones that take much longer to resolve, this could be a warning sign of diabetes. Elevated blood sugar creates an ideal environment for bacteria and fungi to grow. People with high glucose levels often experience recurrent infections of the skin, gums, urinary tract, or vagina, which are harder to treat and take longer to heal. Anthony, 70, had experienced 2 urinary tract infections in 6 months, something he had never experienced before. His doctor, recognizing this unusual pattern, ordered a blood glucose test in addition to treating the infection. The results showed pre-diabetes, allowing for early intervention. If you've noticed an increase in infections, especially in areas like the gums, skin, urinary tract, or for women, fungal vaginal infections, consider this as a possible warning sign of blood sugar problems and discuss it with your doctor. Sign 7. Unexplained weight changes. Our final sign is one that few associate with diabetes. Unexplained weight changes, both loss and gain. In older adults, effortless weight loss may initially seem positive, but when it occurs without changes in diet or physical activity, it could indicate a serious problem. In undiagnosed diabetes, the body cannot properly use glucose for energy. As a result, it begins to break down fat and muscle, which can lead to unintentional weight loss. On the other hand, some people experience weight gain due to increased food intake in response to the constant hunger they feel when cells aren't receiving the glucose they need. Martha, 63, lost 18 pounds in 3 months without effort or changes in her lifestyle. Instead of celebrating, she wisely consulted her doctor. Blood tests revealed sugar levels well above normal, allowing for an early diagnosis. If you've experienced significant weight changes without a clear explanation, especially if they come accompanied by any of the other signs mentioned, it's time to talk to your doctor about the possibility of blood sugar problems. As a conclusion, recognizing these 7 warning signs can make a significant difference in your quality of life as you age. Diabetes, detected early, can be effectively managed with lifestyle changes, proper nutrition, regular exercise, and, when necessary, medication. Don't allow these signs to be dismissed as a normal part of aging. Your body is trying to communicate with you, and paying attention now can help you avoid serious complications later. Thank you for joining us today. We'd love to hear from you. Leave a comment sharing one thing you learned today and how you plan to use it in your life. If you found this video helpful, please like, subscribe, and share. Your support helps us continue creating quality content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.